Today you've chosen to watch tennis elbow, formerly known as lateral epicondylitis. The mechanism of injury that your injured worker will tell you about, how he hurt his elbow, is either repeated flexion extension of the elbow, a repetitive kind of injury, or more commonly one that involves forced dorsiflexion of the wrist with power grasp. One acute event or multiple attempts, sometimes with vibratory injury, noted. This is what causes tennis elbow. So let's go to the physical examination of the elbow to truly find what's wrong, our clinical diagnosis to reinforce the history and the mechanism of injury. Let's look at range of motion of the elbow. Full flexion of the elbow, right equals left. Watch what happens though when we try to go to full extension. Notice the injured left cannot fully extend compared to the normal right. A very subtle finding, but repeatedly found in tennis elbow. And of course the other ranges of motion of the elbow, supination, pronation, not affected at all in this pathology. The second portion of the examination is provocative testing. Does it hurt? Watch what happens when we localize the lateral epicondyle around the injured area and push on it, palpate it. This is the area that's tender, but a finger breadth distal to the lateral epicondyle is really where the tendon, the extensor carpi radialis brevis, tears. That's tennis elbow. That's the localized area of tenderness noted on this physical examination. Notice the marks, notice the bony landmarks, and notice the area of maximum tenderness. That's the history, that's the physical exam portion of the clinical visit, but of course imaging is very important in this diagnosis as well. X-rays probably won't show much at all, especially acutely. Chronically, they can show some calcium deposits. MRIs after 48, 72 hours might be very helpful. Maybe torn tendon, but soft tissue edema as well might show up. These physical examination and diagnostic maneuvers will help you and Texas Mutual define this patient's work injury. Please document these in your clinical notes. Thank you for watching Workplace Diagnosis.